Thank you for joining us on Facebook Live. Hope you all are having a happy Friday. Today we are talking about a very important topic, and that is the integration of the mind and the body. We're going to be doing a special edition in order to honor Mental Health Awareness Month. Before I go on, if you like this video, if you don't like this video, please share it, like it, subscribe, send it to your friends, send it to your enemies, all that fun stuff. If you want to catch this video again, or if you want to see any of our other videos, they're all available on Facebook or on our YouTube channel or on our website at fxregencenter.com. If you have any comments or questions, you can feel free to comment, DM. You can email us at info@fxregencenter.com or call us at 310-929-9790. So without further ado, I'm going to talk about pain, anxiety, and the nervous system. Before I go on, I want to talk a little bit about my journey with mental health and my interest in this part of medicine. And it actually comes from when I was an undergrad. I was actually a psych minor. I was contemplating being a psych major at one point, and I started medical school. And one of the things that I was interested in was psychology and psychiatry, because I was really interested in the workings of the mind. Along with that, I was interested in neurology and the workings of the brain. And eventually, as I learned about the musculoskeletal system through the teachings of osteopathic medicine and looking at orthopedics, that's kind of how I fell into the field that I am in now, and the specialty of physical medicine and rehabilitation and regenerative medicine, ultimately because that kind of combines my interest in the body and the mind. And the reality is that the body and the mind are not able to be separated. They're really intertwined. And when it comes to injuries and when it comes to pain, really the mind and the brain is where it's at. We think of actual injuries occurring to our body, but our perception of the pain associated with that really takes place in the mind. So when someone says a statement like pain exists in the mind, that statement is actually true. Pain is not damage. When we get an injury, when we cut ourselves, when we twist our ankle, when we throw out our back, when we sprain our knee or whatever it is, that injury is a damage or an event that occurred to the musculoskeletal system. But the pain that we feel from that is a perception that is actually felt in the brain. And there's different types of pain that exist. There's the nociceptive pain that occurs from when something that is damaged or injured gets appreciated by the nervous system. There's neuropathic pain that occurs when the nerves themselves are aggravated. And then there's the pain that is perceived and felt in situations of chronic pain. And all of these ultimately are interpreted by the brain. So the feeling or the sensation of pain in whichever manner that occurs actually is perceived in the brain. And that's why the mind and the body are intimately related. So when I see patients in my clinic, I think it's very, very important for us to address all pieces of the puzzle. And, we can't address the musculoskeletal. We can't treat the injury, so to speak, and ignore the brain. Because if we ignore the brain, despite treating a musculoskeletal condition, we can continue to have pain. I've seen many patients that, for all intents and purposes, their body has healed, yet their pain remains. And these are some of the things that I'm going to kind of explore and go into in today's topic. I'm going to dig a little bit deeper, specifically in terms of how pain signals are carried and how chronic pain can actually be affected by things like anxiety. So The way that I'm going to go through this is I'm going to kind of explain what happens over time when we have a pain condition. And this is modified from a TED Talk, and I don't remember where the TED Talk was seen, so I apologize. I can't give credit where credit is due. But this is modified from a TED Talk, so I can't take full credit myself. But I think this is a really great way of illustrating how pain occurs and how the brain can then negatively adjust to pain, actually. So I'm going to say a few different analogies. The first analogy that I'm going to say is, and if any of my patients are joining, you may have heard me say this before, is that pain, when an injury occurs, it's as if your body gets an insult, right? And the analogy that I use for this is that your body is a bank. And when you get an injury, it's as if the body or the bank got robbed, right? So your body is a bank, and when you get an injury, it's like the bank got robbed. So what happens if the bank gets robbed? The bank owner says, hey, the bank got robbed. I got to increase my security system. So in this analogy, your bank owner is your brain, and the security system is your nervous system. So you get an injury, the bank got robbed, your bank owner increases the security system, but then you get another injury, right? Either you re-aggravate the same injury that you had, or you have another injury. Something happens that robs the bank. So the bank owner, again, says, hey, bank got robbed, I got to increase the security system. But again, another injury occurs, or the same injury gets re-aggravated. Or you try to do some physical therapy, or you try to do some exercise, or you get a chiropractic manipulation, but then the area gets aggravated again, right? Each of these occurrences is your bank getting robbed. And each of these times, your bank owner increases your security system. So what happens when your security system keeps on getting increased? It gets more sensitive. So pretty soon, a damn pigeon is walking past the bank and the alarm system goes off, right? The pigeon ain't robbing the bank. Pigeon might be pooping on the sidewalk, but it's not robbing the bank. But the alarm system goes off as if it is being robbed. That is a very important thing, right? Because that analogy demonstrates how a seemingly normal activity, like the pigeon walking on the sidewalk or pooping on the sidewalk, could actually set off alarms as if there is an injury taking place. So what happens when the bank alarm goes off? The police come, the fire department comes, right? All of your muscles tense up, they're guarding, right? You start adopting abnormal movement patterns in order to try to change the body or stay away from the thing that was causing damage. But in this situation, there was no thing causing damage. It was a pigeon pooping on the sidewalk, right? This is a pure example of how the system can become hypersensitized. I'll give you another example. If I hit my elbow on this table, right? If I hit my elbow hard on this table, you know that zip that you get, that funny bone sensation? That's a nerve irritation, right? Because you have this superficial but very important nerve that travels right along the elbow over here called the ulnar nerve. And if that nerve gets thwapped, that's a real word. If that nerve gets thwapped, then that causes some nerve irritation and causes that funny bone sensation. That hurts, right? So what happens if I hit my elbow on the table over and over again? Pretty soon, you better damn well believe that anytime I got close to a table, I'd be like, hey, there's a table there, right? I am sensitive. I am nervous. My body is inadvertently, subconsciously aware of me putting an elbow next to something that previously caused harm. And because of that, now I start shying away from tables, right? Now I start shying away from putting my elbow into that position, and now I start developing abnormal movement patterns. So now even if I just rest my elbow on a table gently, I'm kind of aware of it, right? Again, the system gets hypersensitized. And another way to think about this is as if the the body is essentially, or the pathway that nerves travel is essentially like a highway, right? And if you think of a highway, you think of kind of a road, right? And nerve signals go in either direction on this road. And there's only so many cars that can go on that road, right? But if this is a road that is getting more and more traveled, right? And there's more and more traffic on this road. Well, we pay some pretty darn high amount of tax dollars. The government's going to say that's a busy road. We're going to actually expand that road and increase the lanes so that we can have more signals traveling or more cars traveling on that road. So over time, if you increase the activity of nerve signals, that freeway or highway is going to actually increase to allow for more signals to come through. A great example of this is how we train our bodies when we are exercising, right? When we're trying to work out and strengthen our muscles, or if you're trying to train for a marathon, or if you're trying to weight lift and increase the amount that you're lifting weights, etc., right? The more that we do these activities, when we first start, we get sore as all heck, our muscles are fatigued. It takes us some time to wake up those muscles, right? We have a one-lane highway in terms of the way our nerves are communicating with our muscles. If you work out, but then you take a stop, you take a break for a long time, and then you try to get back into it, what happens? You gotta kind of get back into it, right? But if you're working out consistently, if you're really training for that marathon, then over time there are more signals and there are more lanes that are added to the highway. So now if we take a break for a day and we jump back into it, we still have all those highway lanes there, and those nerve signals can still work appropriately, and we can get back into it and work out strong, right? Because the nerve-muscle connection has improved. That's neuroplasticity. We've had an improvement of the way that our nerves are functioning in a positive direction, right? We're actually able to do more. Same thing happens when we're learning something, right? If we're trying to study for an exam, for example, and if we just studied the night before, if we're cramming for that exam, and then we regurgitate that information the following day, we're probably going to forget that knowledge a couple days later, or certainly a week later or a week after that. But if we're going to class on a regular basis and we're learning that information, and then we're not only learning it when the teacher is telling us things, but then we go home and we study it, and we not only just memorize the words, but actually are internalizing how or what is going on, right? And we're actually learning things. Well, we're expanding the lanes to our highway. And as we're doing that over time, then we take that test, right? That knowledge is actually going to stay and persist because those lanes of our highway have been increased. So the same thing happens for pain. If we get an injury and we feel that pain signal, and we get a re-injury and we feel that pain signal, and we start shying away from movement, and then we try to do a normal movement, but then we feel that pain signal, the more we're feeling those pain signals, the more lanes we're adding to our freeway, and the more robust that system gets. And unfortunately, that means, again, hypersensitivity of the nervous system. So whichever way you look at it, the reality is the longer that we're in pain, the more chronic pain can become an issue, not just nociceptive pain or pain from an injury, but actually an issue with the nervous system as a whole. And here's where mental health comes into play. Anxiety is a real thing that arguably all of us deal with in one way, shape, or form. Now, I'm not talking about like generalized anxiety disorder or panic attacks or depression or other mental illnesses, which certainly play a factor as well, but I'm talking about just straight old-fashioned stress. I'm talking about the anxiety that occurs from, little things like pandemics, or, oh yeah, our numbers are on the rise, or, oh, work, or lack of sleep, or, relationships, or anything in our lives that causes stress and anxiety. Well, the reality is that these type of stressors, these chemical and neurological things that occur that are associated with stress and anxiety, actually increase our bank's alarm system, actually increase the lanes of our pain highways. And this plays a huge factor because this can actually increase the pain hypersensitivity. Now that even normal activities trick the body into thinking that pain is actually damage. So when I see patients in my clinic, the reality is that we can't separate the mind and the body. And when I have patients that have had injuries that are long-standing, that are things that are going on for a long time, with pain that has been going on for a long time, we have to hit things from multiple angles. We have to hit the thing that's causing the pain in the first place, the structural issue for sure. We also have to hit our insides, our nutrition, our hydration, all the things that allow our body to heal, but we can't neglect the mind. We can't neglect the fact that our brain is what perceives pain. And we need to, just being aware of this fact ends up playing a factor, because then we could recognize that, maybe we need to take some appropriate measures to address some of the stressors in our life. And maybe we should take the appropriate measures to actually try to change that pain hypersensitivity. Retrain the nervous system into recognizing that not all pain equals damage. Not all pigeons pooping on the sidewalk are going to actually be robbing the bank. And doing things, learning strategies to remind ourselves of those facts. And also learning strategies to help with alleviating some of our day-to-day stressors, which may be actually adding fuel to the fire. So concentrating on sleep hygiene, that could be one of the most important things for managing stress. Talking to someone, talking to a therapist, a loved one, a pastor, a priest, to really try to address all of these things from multiple angles. The more that we can control our stress and our anxiety, the better opportunity that we have in success for treating your musculoskeletal pain condition. So, all in all, we really need to hit things from multiple angles when we have injuries, when we have pain conditions. We can't neglect the fact that the mind and the body are connected. And we can't neglect the fact that anxiety and depression and stress, even in the absence of mental illness, we have to understand that mental health is so important in managing our injuries and pain conditions, in recovering not only from the pain or injury, but back to being functional in our lives and being able to do the things that we love to do. We have to hit things from multiple angles, addressing the body and the mind. Hope that all made sense. Hope all my analogies didn't confuse you further. I did not mean to, and apologize if I did add more stress to your life by using shoddy analogies. But hopefully this helped in getting you to understand, how the mind and body are connected. If you do have any questions about what we talked about today or any other topics, then please feel free to comment, DM, email us at info@fxregencenter.com, or call us at 310-929-9790. Please like, subscribe, share this video and all our others, which can be found on Facebook, YouTube, or our website, fxregencenter.com. This is Dr. Patel. Hope you have a great Friday and rest of your weekend. Wishing you the best on this Mental Health Awareness Month, especially. Best wishes, and I'll see you next time.